Mr. Chairman, I rise for the purpose of a colloquy regarding an amendment that I had intended to offer relating to military families. And I move to strike the last word.
Gentlewoman strikes the last word and is recognized for 5 minutes.
Thank you very much. Mr. Chair, our military personnel have access to great health care through TRICARE. But in certain cases, and many would be surprised to learn this, TRICARE does not cover every health service, and this is comes into play sometimes with children of military families with special needs. There is also a circumstance when someone in the military is separating from the military, but they don't have retirement benefits, and their family, their children, may not have access to health insurance. I ran into this in a case back home in Tampa, Florida, at MacDill Air Force Base, not unlike many of our colleagues here who participate in forums for veterans and job fairs and the like. And the military health folks were they didn't know a lot about Medicaid or the Children's Health Insurance Program, whether it applied to military families that they talk to all of the time or those families that are separating from the military and are no longer covered by TRICARE. So we tried to investigate this with the Pentagon a little bit, but they were not able to clarify anything for us. And I've done a little research. There was one report entitled Medicaid's Role in Treating Children in Military Families. And that report advised that 1 in 12 children from military families rely on Medicaid for some health service. And for children with special needs in the military families, 1 in 9. I was surprised to learn that, frankly. Plus, we have many that have served in the military, have come back from Iraq or Afghanistan. They have a lot of questions about what it means for them finding a job, finding coverage for their family as they move on in their lives. So I had intended to offer an amendment that simply clarified the fact that nothing prohibits DoD from providing that information at a job fair, a health fair, or advising military families that the Medicaid coverage or the S-CHIP coverage could be an option. So I'd really like to work with Chairman Young, the Department of the Defense, Ranking Member Dix, so that our military families don't have to worry about health coverage, whether they're in the military, they have children with special needs, or they're separating from the military, and they just simply need answers to questions about where they can turn. I'll reserve the balance of my time. Or I'll yield to the chairman.
Mr. Chairman, I thank you for yielding, and I want to thank her for the attention and the hard work that she does to ensure that our military service members and their families have the very best information and resources regarding health care. That is only fair. One of our highest priorities has always been to take care of the health of our men and women in uniform and their families. So I thank the gentlelady again, my neighbor in Florida, for her advocacy on this issue, and guarantee that we will be very happy to work with her and the department to make sure that all relevant health care information is available to our service members, our retirees, and their families. And I thank the gentlelady again.
Well, and Mr. Chair, I thank the chairman, and this is especially meaningful coming from Chairman Young, who no one has been more attentive to military families, our service members, no matter what service, no matter their veteran status, than Mr. Young, my colleague and friend from Florida, and I thank the gentleman and yield back my time.